patients get better? What does better mean in relation to schizophrenia?
Well, it's a very good question. So there are all gradations of getting better. The old gradation used to have to do with delusions and hallucinations and disorganized thinking and maybe negative symptoms. And so getting better meant getting better symptomatically, that the patient was no longer as delusional and no longer hallucinating as much, and even with drugs, you don't do away completely with the symptoms, but the symptoms do get better. Nowadays, this is quite a twist. Nowadays, getting better means something differently from what I've just been describing. What it means is getting back into the community and functioning more like other people do. And so we've had a number of patients in our schizophrenia study who still had their delusions and hallucinations, and yet they now had a job, they were living independently, and they had friends, and one of them got engaged and got married, despite the fact that they still had the delusions and hallucinations, but they had been quelled. And now the push is much more so getting the people back into reality. And when they get into reality, and there are a whole series of methods that we use to help them get into the mainstream. Once they're into reality, then their unreality seems to diminish. And we've had some patients where we didn't even bother with delusions, hallucinations, but we would help the patient set up their own personal goals. And as they strove towards their goals, their disorganized thinking improved, their memory and attention improved, and their overall functioning improved, and they were much better adapted then to the society that they were going into. So it's a good question, and so there's a shift over now as to what means getting better. And the modern definition